Hi, I'm Janet Sharma. I'm Janet Sharma. I'm the coordinator of the Age-Friendly Englewood project. And Shannon Doherty-Lyons from Generations for Garfield was who introduced us. Pardon me. We're going to talk to you about the best practices that have been gleaned from our age-friendly efforts in the 5 towns that originally were funded to do this work: Englewood, Garfield, Ridgewood, Teaneck, and Westwood. And more recently, Fairlawn and Glen Rock have started, but their results haven't been generated yet. So we're just talking about those 5 towns. Next slide, please. We started in 2016. The Henry and Marilyn Child Foundation issued an RFP seeking communities to form coalitions that would help older adults age in place. And that's pretty much what each one of us did. Each town formed its own coalition and had a coordinator to sort of keep all of the ducks in a row. Grants were awarded to the 5 towns. We each got approximately $75,000 a year for 5 years, which really was instrumental in making sure this work went forward. Next slide, please. Again, the flower that I'm sure we're all familiar with, it's the 8 domains of livability that were formulated by the World Health Organization and AARP. And pretty much all of us have used this format as a framework to guide our work. I know in Englewood, we combined a couple of these categories, and I know with the Age-Friendly New Jersey Advisory Council that the Deputy Commissioner was just speaking about, they also combined a couple of the domains just to make the work a little bit easier to digest. Next slide, please. But the goal really was to embed age-friendly into the community. That's the bottom result, is that we want every community to become age-friendly as just a matter of course. They keep it in mind all the time. What we did over the last 5 years, and now going into 6 years, is really the best things that came out of it were data-based advocacy. Everything is based on data that drives what we did from our needs assessment going forward. And then community building through collaboration, that is essential in every one of our communities. And then effective communications and finding out what works. Also events, not discounting events, because they're a great way to gain credibility and to communicate. During the pandemic, we excelled at doing Zoom events, dance parties, whatever, but communication of all sorts. Next slide, please. And now Shannon's going to talk about the next couple of data points.
Okay, so we're going to go a little more in depth into each of those best practices in the next couple of slides. So this best practice we call data-based advocacy. Just in full disclosure, in my background is my training is in research and doing some basic science research. So data is something that I love and I know quite a bit about, and it's very helpful and informative if you use it and you use it, to really understand processes and what's going on. So this was actually EJ's slide from Age Friendly Teaneck when we all presented this work together. If you were at NJA, we were so happy to present this at that meeting as well. And what we really wanted to talk about is the process of using data to really assess what older adults and residents were expressing their needs to be and what services they already had available, to gather that data, analyze it, and then identify needs and gaps in services, and then develop a plan to meet those needs, and then make sure you're doing ongoing assessment of your programs or services or whatever you have use this data for to develop a plan. So data is super important. It's great, but you really have to, and it's an opportunity to really advocate for change. If you just don't do a survey and kind of let it sit, you have to use that data and really explain what's useful about it. So it can either be global or a little more local.
Village of Ridgewood, this is Janet. May I help you?
Oh, I think we might need to mute there.
Yeah.
We can use it to, spot trends, to find new opportunities for growth, to plan programs, make improvements, really look at your goals. If you're in like an age-friendly initiative, we did goal setting every year and at the interim, or really tell your story, like use the numbers to say what you need, what you want, what's working, what's not working. And in Teaneck, what they did to tell their story was, use their needs assessment, look at the data, go to their council, and say, this is what we see, this is the data to back it up. And they were able to actually hire a full-time social worker based on the data that they presented. And so that is a really great way to use data to tell your story and really fulfill a need and develop something that's very useful for your community. And speaking of community, the next best practice that Janet introduced was community building and using coalitions to strengthen your community. And I worked in Garfield for the last many years, actually, and on Age-Friendly Initiative the last almost 6 years now. And this is one of our favorite slides when we talk about our work, because it really outlines and shows you at a glance all of the partners that we've worked with. We don't work with them all at the same time, obviously, but we've worked with every single one of these partners on different projects, maybe providing services, maybe working together. We just presented about our challenge grant in the last session, which was a great session. And we worked with a lot of our partners for that event to really look at the needs of the community and build a strong team that works together to serve Garfield. So just to define a little more clearly what we call coalition building, all those community partners that I just showed you on the last slide, we want to build on those relationships to also encourage age-friendly practices. So from an age-friendly lens, we have all these partnerships, we all work together. What do we want to do with those relationships in a productive age-friendly way? And really it's about integrating age-friendliness into the community. And you can do that more broadly when you have a coalition that you're working with. And it really serves the community very well. So you can, I mentioned the challenge grant, you can apply for funding, and you can really expand what you can do with the team versus just, maybe one initiative trying to push through. And we mentioned events. Actually, Janet's going to talk a little bit about that and advertising them. And we really try to attend each other's events. Each of those partners does their own work also. And then we come and we work together, but we try to support each other in those events. And it helps, promote what they're doing. And some of them can just be fun social events, and that's important too. So we just try to show up for each other, and that strengthens our coalition for sure. So I'm going to throw it back to Janet for the last couple of slides to talk about our last best practice and summarize.
Sure, we're going to talk about communications. Aging, as you all know, is a spectrum. I mean, I heard one gerontologist speak to us when we were first beginning this work, and she said, when a baby's born, you pretty much know what it's going to do at 6 months. It's going to sit up. It's probably going to walk around to age 1, and then so on and so forth. You have benchmarks along the way. In aging, it can be all over the place. Some people age a lot faster than others, so there is no one size fits all. So the same with communications. We have to meet people where they are and use a number of different ways to reach people. The second one about digital connection, it's not always present or desired. We found in Englewood when we did our needs assessment that about 20% of the people didn't know how to use a computer or didn't have access to a computer. That may have changed over the last 5 years, but we have found on a daily basis that there are several people, many people who just don't want to use it. So we have to, if they're not going to use it, then we have to be able to communicate with them with however they can be reached. And we also engage our partner organizations to cross-share information. That's essential because some of them see people in person, either on Zoom or really in-person events. And so we want to make sure that the information can be shared wherever they have an opportunity to reach people. Next slide, please. We did a number of different publications and ways of reaching people in Englewood. E-newsletters, website, our social media, podcast, videos. I know Teaneck had really excelled at doing some how-to videos for people, how to use Zoom and things like that. We did the publications that you see on the screen. The At Your Service directory has been very well received. It's about 60 pages about different social services that are available in Englewood and at the county level, and some state and national things like Medicare and so forth. The postcard that says Englewood residents, that was a snail mail piece that we did to tell people how they could get help during COVID. It had phone numbers for different agencies in the city and so forth. And then the one that says Age-Friendly Englewood, that's our website. And as you can see, we have links to any number of things. So we have different ways to reach people wherever they are. We use the library, displays at the library, houses of worship. We send messages to their bulletins so it can get out to the people in the congregation, however they reach them. And also resource kiosks. I know Westwood has a kiosk in town with lots of information that's available when you go to that kiosk. And then events. We did a number of in-person events before the pandemic, things like preventing falls or about Medicare or about how you can take care of your home safely, make your home safer, and also save money by maintaining your home. And then during the pandemic, we had all sorts of education programs online, as well as dance parties and other kinds of activities where people could get to know each other and just be with other people, even during the pandemic. Next slide, please. And then the overall, we had Shannon, I think you were going to talk about this one.
Sure, I can. So just in conclusion, we wanted to give you some concrete ideas for best practices. Janet talked about setting the stage for age friendliness and then using data to really advocate for what your community needs, what you hear from your community, not just setting out a set of ideals and saying this is what we should do, but really using that data to either advocate for specific programs or just for your age-friendly initiative overall. A lot of people start with a survey, which is really important, and that's a form of data gathering, and you can use that to set your goals and then outline your programming. Coalition building, absolutely super important to strengthening your community and really just having a team approach to what you're doing so that you can continue to build that team out, and that just makes your community even stronger. And using all sorts of communication. Meeting, like Janet said, meeting people where they are, whether it's digital, snail mail, Zoom, however you can best communicate with your community. I think that has been reiterated over and over and over again, that there's not one way to communicate with any population. You really have to take more of a broad-based approach. And so those are, yes, that is the end of our slideshow. Those are our best practices that we wanted to share with you today. And then we have until 10:40, right? So we have like a good 10 minutes for questions and conversation. If you don't have to use the little button, if you want to just talk or kind of raise your hand, we'll see you and we're happy to answer questions.
One thing I wanted to mention that Shannon alluded to it about in the coalition forming and of partners and funding. We were able to get a number of our partners to help support the communications that we have. For instance, the hospital, Englewood Hospital, is very anxious to get their name in front of people wherever they can. So that beautiful directory, the directory of services, the hospital printed that for us. They actually, the first time we did it, I put it together myself using a desktop publishing program. But the next time we did it, the hospital put it together for us. They redesigned it and did all of the graphics and everything. And it's really a beautiful book, and they paid for it. It was thousands and thousands of dollars. Also, several banks in town want to make sure that people know about them. So they have been supportive of the work that we've been doing. And also, I can't emphasize using the other partner organizations to get the word out about different programs that are available. There are all sorts of activities that are available, but in most places, people would have to go to umpteen different websites to find that information. So we compile the information into our newsletters and get it out that way. So people go to one place to get all of this information. And it's just made such a difference in helping people find out what's going on and not feel so isolated.
Arlene, you have a question?
I wanted to just bring up the issue that I advocate for. As I mentioned, I'm deaf and have cochlear implants. I'm the co-founder and past president of the Hearing Loss Association of America's New Jersey State Association. And in advocating for people with hearing loss, people who are older, the percentages go up quite dramatically, so that over 50% of the people have hearing loss. And the identifying trait is they really don't know how to advocate or even what they need if they get hearing aids or any assistance at all. So what happens is it falls on the presenters like yourself to provide inclusive environments, to use what we call universal access, to assume that there are going to be people with hearing loss there. So that means providing captioning, that means having induction loops and educating about that, so that people are invited. So if you're showing movies, show them with captions. If you're having an event, have assistive listening and have captioning there as well.
Yeah,
And
very important, very important.
the kicker I really want to leave you with is that with Zoom and all these online presentations, I am involved with classes online using Zoom, and it is easier for me to participate because the sound is right there. The automated captions come up. There's no traveling. I don't have to worry about getting sick. And that has been my go-to. It is easier to do that than to actually try to do it in person. Of course, there are pluses and minuses, but I just wanted to mention that to you. I was astounded. This is what I prefer. So if a class meets in person, no, I'd rather it meet on Zoom.
Well, that's true for a lot of people because the commute, especially in New Jersey, with the distances and traffic and so forth, a lot of people would prefer Zoom.
But the sound, everybody's speaking to a microphone, everybody's looking at you, and the automated captionings make it all accessible. It's like a dream. So
Right.
it's really crazy. Also live streamed, if you have Chrome as the browser, it has an automated captioning feature, has to be clicked on. And that means anything live streamed comes up captioned. So all your religious services coming up, they're live streamed, and on my computer, it just captures everything.
That's
So
great.
it's a crazy world. Yeah, there's much more, but you have 3 minutes or something.
Any other questions, comments?
Are any of you involved in an age-friendly community? Dorothy, I think you are.
Yeah.
Yes, I am out of West Orange, and I really want to thank you so much for all of your great ideas and what a wonderful presentation, because we're facing some of those similar hurdles. We've been trying to get a resource book and get it published, and it is very, very expensive. And one of the ideas that you mentioned, reaching out to a hospital, which we have, as well as some banking institutions, I think that's a
Right.
fantastic idea.
Yeah, they were glad to do it because they want to get their name out there. They also, another thing they did just recently was the change in the grocery bags. The hospital printed thousands of grocery bags and they asked us to get them out through our partners, which we did. And everybody was happy. They loved the bags, and it has, Englewood Health big and bold on the bags. And we used our age-friendly coalition to help get those out.
Oh, what a great idea. Thank you
Yeah,
for that.
that's great. Yeah.
I've been taking notes voraciously.
Well, feel free to reach out if,
Yeah.
sorry, go ahead.
Oh, I'm just Melody with NJ Tip. I was just talking about, we worked in Bergen County,
Right.
where we helped make a transportation guide, and we found that like a lot of people found it helpful. And then
Absolutely.
like talking to the different communities, like going from Westwood, and recently we started working with Fairlawn this year,
Fairlawn, yeah.
and stuff like that. So yeah.
Yeah.
But yeah.
Also, somebody mentioned, I can't remember which of you put it in the chat, about diversity, equity, and inclusion as a part of the domains. After George Floyd was murdered, the coalition that we put together also had so many people who were just so upset and passionate about this that we formed a coalition for racial unity and equity as a separate committee that came out of the coalition, and is still doing a lot of work in that area.
Okay, that's great to know. I mean, when I read that there were several communities that were including that interweaving it into the 8 domains, I thought, what a wonderful, wonderful
Yeah,
idea.
well, equity is very important because there's so many areas of aging where it is inequitable, certainly based on income. If you have money, it's a lot easier to get old than if you don't have money. And if you can't get the kind of care you need, or the health care, or the place to live, it's just not equitable. And so that's got to be a real concern.
Mhm.
Anyone else? Again, like I always thought in the beginning it was so much time, but it seems to go pretty quickly. We have only 2 minutes left.
Could I ask a question? Arlene Romo, what is the name of the organization you founded in terms of hearing loss? You mentioned an organization.
Yes, it's the Hearing Loss Association of America.
Is that what-
Okay, so hearingloss.org. And the New Jersey State Association is the New Jersey affiliate of that national organization. And we have a few chapters, Bergen, Essex, Gloucester, Atlantic. And we have a walk for hearing coming up on October 9th. I can put my email address in the chat, and you're welcome to
Fine.
email me to provide more information.
Also on this handy, our guide on page 26, there are a whole
what?
lot of hearing loss organizations. And if you go to the Age-Friendly Englewood website, you can click on that and see the directory, page 26.
Age-friendly,
Age-friendlyenglewood.org.
okay. You're very organized. How long has it been, how long have you been in existence?
Age-Friendly Englewood, we started in 2016.
Oh, I missed the, can you just repeat how to get that booklet? you're saying?
Age-friendlyenglewood.org.
No, I don't
There much
understand it again.
community,
I'll put it in the chat.
Okay.
does your township offer any services, or do you get much support from the township, your town?
Well, during this process, again, Garfield gets a lot more than Englewood. During this process, Englewood has had 7 city managers. So we have had not as much success as we would like in getting it embedded in the city, although we do work closely with the city engineer, the DPW, Parks and Recreation, the library, and so forth. Shannon, do you want to talk about what you're doing at Garfield? Because you've done more.
Garfield definitely is pretty well supported. We do have a new city manager now in the city, but the public health nurse spearheaded the age-friendly initiative in Garfield with the support of the city. So her time was actually in kind, which was great, and just kind of a different way to set that up. The age-friendly initiative was actually housed under sort of the umbrella of the city. And if you want any more information on that, definitely feel free to reach out, and I can kind of share more about that. We didn't really go into the structure of our initiatives in this presentation. We were going a little bit different type of conversation, but I'm always happy to talk about how we set our initiatives up. I'm trying to finish. We have 5 seconds. So thank you so